First, we're going to look at some of the implications of hormonal changes. We're going to take a look at hormonal changes. So, the human chorionic gonadotropin, which is the HCG, and progesterone. This picture is a rendering of the hormone relaxin. Hormones drive the bus for the changes during pregnancy, and they're incredibly powerful. When you do a pregnancy test, there are testing hormones in the uterine. When we look at HCG, this causes morning sickness. When we look at progesterone, this keeps the uterus and smooth muscles relaxed. It helps the immune system tolerate the fetus, and it relaxes smooth muscles in the body, which can lower blood pressure and increase gastrointestinal pregnancy symptoms like heartburn and gas. It also can relax the veins, which have a smooth muscle, which can impact functioning of the valves like the stomach and the esophagus. This can also relax smooth muscles in the intestine, leading to constipation. So when we look at progesterone, HCG, and asana, we have given the effects of HCG and progesterone. But what modifications and suggestions can we give to prenatal practitioners? If mama feels sick, honor how she feels. It's okay to rest and leave the room if she needs to. Looking at inversions like forward folds and downward dog may increase symptoms of acid reflux. If inversions are uncomfortable, encourage mama to stay upright. If blood pressure is low and they feel dizzy, encourage them to come out of the forward fold slowly to give the body a chance to adjust. When we look at the other hormones, like relaxin, this is discussed in the next slide. The other hormones, such as estrogen, oxytocin, prolactin, and more, move around the system to keep things developing nicely. As they don't impact movement but are more for development, we will skip over these. Let's take a look at the hormonal changes and relaxin. Relaxin loosens the connective tissue in the body in preparation for birth. Relaxin can come on as early as in the first trimester. And relaxin affects all connective tissue in the body, which means the fascia, the ligaments, and the tendons. When these tissues relax, joints become looser and may be less stable. So we ask a question, what kind of effect will relaxin have on asana practice? When we look at this, we can consider how relaxin will impact or modify the asana for the person the mama who is pregnant. You want to look at standing poses and a firm foundation. You would look at balancing poses. You want to be making sure that you're looking at inversions. You also want to incorporate the use of props in your classes. Also encourage seated poses and deep stretching. So what kind of effect will relaxin have on asana in the practice? With standing poses and a firm foundation, we encourage moms to keep their feet under their hips rather than together. We keep the feet hip distance apart, for example, in neutral standing poses, and we widen the heel to heel alignment. We engage form closure of joints using muscular effort to stabilize the joints since connective tissue is loose. When we look at balancing poses, encouragement of the use of props when balancing, like holding onto the wall or using a chair. We modify to maintain stability. For example, taking baby tree rather than a normal tree pose is something that is modified but still engaging in the asana posture. When we look at inversions, we want to focus on the upper body that is affected by hormones as well. Remember, the shoulder joints may not be as stable, and approach with caution and use care with muscular energy. When we have the use of props, we use props to help support the body. We use props like the wall as a prop or a chair as the prop. In seated poses and deep stretching, we want to encourage to engage in practices that increase stability. So perhaps we're not looking at yin. We want to resist the desire to exploit new flexibility in stretching poses. These ligaments want to return to their functional length after. And you don't need to do your deepest pigeon pose right now when you're pregnant. Students who are in the 200-hour yoga teacher training section of this course, I encourage you to write down the modifications for relaxin in your manuals or in your journal or in a notebook. When we look at modifications for relaxin, we want a wider foundation. We want to use muscular energy to support the joints. We want to use props to keep balance and maintain stability. And we want to avoid deep stretches that exploit loosened connective tissue.